Hi everybody, welcome. My name's Jordy, and I'm here to talk to you about how traditional Chinese medicine, TCM, can help alleviate back pain. So the number one treatment modality for back pain would be acupuncture. Needles in the back, in the neck, in the shoulders, on the legs, sometimes on the arms. All these places can actually help the back in different combinations and in different presentations of pain. You can also use fire cupping and gua sha to help treat back pain. So fire cupping is using the suction force of the cups along the back, whether we're sliding it down the back with massage gel or leaving them retained in one spot for like a minute and a half, 2 minutes. Depending on your constitution is how long we leave the cup on for. However, at the end of the day, I just wanted to come on here and share a little bit about how back pain can help you, even if you don't know anything about Chinese medicine and acupuncture and fire cupping and all those different terms. And I also wanted to help in this video kind of give some advice to some of my, well, just not even advice, but clinical observations to people who might be interested in learning from them, or even writing what their own observations were in the comments below in helping treat some of these different types of back pain, neck pain, and shoulder pain. So first of all, when someone comes in to me to see me for acupuncture or fire cupping, or maybe even it's just a free consultation at Jade Therapies in Yarmouth, during the free consultation, I'll ask questions about the entire health picture of your life, like medical history, what you're currently going through, stress factors, lifestyle and work factors, as well as different symptoms you might have already that might seem unrelated to your back pain. But by finding all those different details, we can confirm whether the back pain has a deficiency or excess presentation in your health diagnosis from a Chinese medicine perspective. So when we know if your pain basically is either like something that's extra in your body, like it's creating more heat, it's creating more tension, it's a flare up of like hot, active, or stuck energy, and that can be back pain, like in the neck, in the shoulders. It also can be a dull, like less angry type of pain that just seeps into the bones or deep in the muscles in the low back, in the knees sometimes as well. So we have different causes for back pain, and in a initial consultation, by asking about other areas of your life, we can see patterns of whether you have more of a deficiency-based pain or an excess-based pain. And just starting with that alone will ensure that the treatment doesn't hurt the person who's getting the treatment. It's not going to make it worse. And I love that. That's what makes acupuncture great, because we're very sensitive to what your body needs. So let's just talk about neck pain first. Neck pain is usually caused by being hunched over, bent over our phones, typing on a computer, sitting at a desk all day. Those are classic presentations of neck pain. And sometimes it can be from turning it too quickly, or from a car whiplash. It can be from all kinds of different things that happen to a lot of people on a regular basis. But what a lot of people don't realize is that it can actually happen from cold air, or cold air basically getting into the neck and the face. That can freeze up the neck as well. I had one client come in recently who woke up after a night's sleep completely stiff. They could not move their head in any direction, up or down, side to side, and they were in intense pain. Well, after doing a full consultation with this individual, we narrowed down that she slept with the window open recently. It's right above her bed, and and this only happened a few days before she came to see me, so I could even remember what the weather was like that day. So long story short, she had a cold breeze come in at nighttime when it was very hot all night and all day before. So her pores were more open. And this cool breeze got into her neck. It was falling right down on her shoulders and neck from above the window above her head. And it froze up all the blood and chi in the channels. There probably was not enough blood and chi in the channels to begin with. Maybe she had a deficiency-based picture of blood and chi. But long story short is, after a very light therapeutic cupping session around the neck so that it didn't create more pain in the moment, and also doing a little bit of light scraping with the gua sha tool, she was able to at least have a good night's sleep a couple days later, and the pain was probably reduced by half, maybe even more. We did acupuncture at the base of the neck, the wind pool, which is right at the base of the skull on the top of the neck there. And at that point, almost every time you do it, if your head has trouble or pain turning left to right, it'll turn more easily after using that point, and it'll get rid of the wind in the neck. So we did 2 treatments. We did the first gentle treatment, and then we did a stronger treatment the second time, and she's doing a lot better. So neck pain, like I said, it can be from being hunched over, it can be from injury, and it can also be from weather. The good thing about neck is that if you just use the gallbladder GB20 at the base and the GB21 on top of the shoulders, if they're not too deficient, that'll really release everything. If they are deficient, you use SI12 on top of the shoulder blade, and it doesn't make them tired like GB21 on top of the shoulder mound can. So yeah, that's a little bit about the neck. With the space between the shoulders and the tightness from the shoulder blade down the arm, that can be treated by basically just using points like SI11 and SI12. SI12 for the trap release on the top, SI11 for releasing the back of the arm, and the space between the shoulder blades can be released with bladder 13, because that's a very effective point, especially if someone has been under a lot of identity changes, like a lot of changes in their life. They've just experienced a lot of change recently, and they're having to like reconcile with those changes, and it gets into like the grief factor of bladder 13. So I would say if you're trying to treat the upper back from an acupuncturist perspective, it's really just a couple of points, and that can release the whole shoulder. So it's really great. If you have shoulder pain right in the rotator cuff, you can put needles right in the rotator cuff, and there's also a point halfway down the calf near the shin bone. Both those strategies, the point further away on the leg and the points right in the shoulder, can relieve shoulder pain, make it be able to move up and down, side to side, can give it more range of motion. So those are some tricks for the upper body. Now, the spine in general can be sore, like the whole spine, the whole back could be tight. When the whole back is tight, the spine is sore, you can use SI12, SI3 on the side of the hand and bladder 62 on the below the ankle. These activate both the bladder and the bladder channel, which runs along the whole spine from top to bottom, and the small intestine channel, which runs along the shoulder scapula down the arms. So this really releases the whole spine and can be a really good tool in the tool belt. I find that one's not reliable. Maybe I'm just haven't figured out how to use it quite right. But I find that if you just treat different sections of the back and neck as different things, you can get an overall effect of like a big improvement overall. So, because oftentimes you can have a tight neck from weather or from strain. You can have older pain in the shoulders that needs to be released as well. But then you can also have a tired low back, and you don't necessarily get benefit from just doing local points for that. Like if someone has any type of deficiency at all, usually in every treatment, you should pretty much always be using kidney 3 on behind the ankle. And this point behind the ankle tonifies the kidneys, which are the low, like in the low back, and creates warmth in the low back and strength. And by tonifying the spleen, chi and blood, both the stomach 36 during during a face-up appointment, or when the client's face up on the table, or you can even use bladder 20 at the mid back area, as well as bladder 23 to tonify the kidney and spleen. This is going to boost the energy of the organs that govern the low back. The spleen governs muscles, the low back is all muscle, and the kidneys govern the low back in general, the lumbar spine, and bones in general. So I've seen pretty much every low back case is chronic, is what I've seen so far in my practice. If it's a low back that recently happened and it's really painful and it came on due to injury or strain or even weather, once again, you can use cupping, and that can very much alleviate the low back, as well as the shoulders and the upper neck. Like, I have to say, I've really grown fond of fire cupping for treating things in general. I will recommend it if I even feel just the slightest hunch that's going to help, because there are ways to modify it so it's not going to like deplete someone who's very deficient. And there are a lot of cases where people have deficiencies, but cupping will still be very helpful for them if done right, if done in the right way, with a more gentle approach. Because moving stagnation allows the deficient organs to boost, like have space to create more chi and to not have to forcefully move that stagnation itself. So just by organizing the chi and the energy flow in the body, you can move stagnation out of the body, and this gives you an energy boost, basically, which is really cool. So you need that energy boost to tonify the low back. You're basically boosting the heat, boosting the circulation, giving the organs in that area a boost, and activating the locations of the low back with points that are going to boost the organs and actually be in the low back at the same time. So it's very effective to use bladder 23, bladder 20, and even bladder 18 in a lot of cases to help with back pain, because liver blood can be part of it as well. So it's very interesting. Oftentimes kidney 3 really does help in general. I've had someone who was in excellent shape who had low back pain right in the lumbar spine, like right in the middle of the back, not on the sides of the spine, basically at do 4, for those of you who know points. And he had pain there. Actually, it was at do 3, but it was very close to do 4. And he had scans done on his spine. Nothing was wrong down there due to the scans. So it was like a deficiency pain, basically, a weakness of the kidneys, which showed up in other aspects of his health too. So long story short, we did the low back point, and I didn't actually get feedback from him, so maybe I'm hoping it worked. A lot of times people don't come back after it works. But I knew that's the only thing that could work, because it wasn't an injury, it wasn't chronic, in the sense that, like, it was chronic, but it wasn't like affecting him in a way that most chronic cases do. He still had a lot of strength in his back, even though it was sore right there. So it's very interesting. That kidney 3 point, which is on the ankle, by the way, is a really powerful distal point for low back pain. Bladder 40 behind the back of the knees can help release the back and the hips as well. The hips can be released with gallbladder 41 and Sanjiao 5 on the wrist and ankle. So those are also good points too. All right, well, we got more into the acupuncturist perspective in this video than we did with like perspective on just a client coming to see me. But if you watch this video because you have back pain and you've made it all the way to the end, now you know that there's a lot of different perspectives from a Chinese medicine point of view on how to treat back pain. And it can even be helped with herbs. It can definitely be helped with Qigong, which are all part of Chinese medicine as well. And anyway, if you have any questions or if you wanted to add your own 2 cents on what I've talked about, I'd love to hear about it in the comments below. Because I'm very interested in learning from everybody in my field as well and from other fields. Take care, and I'll see you next time.